people's lives. And there is no better embodiment of this notion than the President of the United States today. He's been reading a lot of words lately, even drawing some praise for it about wearing a mask, for instance, and social distancing. But he neither wrote them nor meant them, and we know that by his actions, by these actions, by this video of him arriving today in Tampa, Florida.
Thank you very much, everybody. That's really great. Thank you. Thank you for being here. It's a good crowd.
A good crowd, he says. Note, though, no social distancing, no masks. He traveled to Tampa in part for a roundtable on the virus. This is how we end this week, a week in which the virus went right on doing what it does. A week that saw the death toll pass 150,000 Americans and infections top 4.5 million. Against that backdrop, the House Subcommittee on the Coronavirus Crisis heard from top members of the president's own task force. And what lawmakers heard for the most part was a thorough debunking of falsehoods, of false hopes, and do as I say, not as I do BS that COVID-19 unfortunately thrives on, such as the president's patently insincere call for mask wear.
I am appealing to all Americans to be part of the public health solution. Wearing a simple mask properly, it's critical to limiting the transmission. Be smart about social distancing and being in crowded spaces.
And yet after all this, try telling it to the boss, who also appeared at a crowded, mask-free event in Texas this week, and whose mask-free visit to Florida today comes just a day after the death of his friend and surrogate Herman Cain, who attended Trump's big rally in Tulsa last month and fell ill with the virus a short time later. The president's trip and the behavior he modeled also comes in the wake of Congressman Louis Gohmert's COVID diagnosis and is just bizarre speculation that covering his face actually made him sick.
I can't help but wonder if by keeping a mask on and keeping it in place that if I might have put some germs, some of the virus onto the mask and breathed it in.
Well, that's garbage, and it was debunked today.
Does wearing a mask give people COVID-19?
Does wearing a mask give it? No.
Okay.
Not to my knowledge.
He had a smile when he said it. Also debunked by his own experts, the president's repeated defense of hydroxychloroquine and a doctor who touts it. That doctor also happens to believe that women can be impregnated by witches and spirits in their dreams. We're not making this up.
I was very impressed with her and other doctors that stood with her. I think she made sense, but I know nothing about it. I just saw her on, making a statement with very respected doctors. She was not alone. She was making a statement about hydroxychloroquine with other doctors that swear by it. They think it's great. So she was not alone.
That's the president just 2 days ago. So listen to the facts, listen to the experts. Here's Dr. Fauci today.
Do people take hydroxychloroquine as a cure for COVID-19?
The overwhelming cumulative evidence of properly conducted randomized controlled trials indicate no therapeutic efficacy for hydroxychloroquine.
That's how science works. So Dr. Fauci was later asked about the one study that the president likes to tout in support of the drug and debunked that talking point as well.
The Henry Ford Hospital study that was published was a non-controlled retrospective cohort study that was confounded by a number of issues, including the fact that many of the people who were receiving hydroxychloroquine were also receiving corticosteroids, which we know from another study gives a clear benefit in reducing deaths with advanced disease. So that study is a flawed study, and I think anyone who examines it carefully is that it is not a randomized placebo-controlled trial.
Listen to the experts. So on to the next falsehood from the president. The president, as you know, repeatedly claims that testing is overrated, that it is testing that makes the country look bad, and if you somehow did less testing, there'd be fewer infections. Here's yet another member of the president's own coronavirus task force.
Testing is an essential component of America's public health response to COVID-19. Testing enables clinical decision-making. It heralds impending outbreaks. It informs resource allocation, and it assists in minimizing economic and social disruption.
Well, the president's apparently not listening to folks like that, employed by his own administration. Testing is how South Korea, for example, kept its death toll below 300, just 300, without ever having to fully shut down the economy. It is how Germany kept its own outbreak in check. And it is something that this country has never gotten a handle on nationally, never developed a national strategy to address. Why would you, when the president himself calls it overrated? And why test for something the president says, has said repeatedly, will just go away?
It's going to disappear. One day it's like a miracle. It will disappear. It will go away. Just stay calm. It will go away. It will go away. You know it is going away. And it will go away. And we're going to have a great victory. It's going to go away, hopefully at the end of the month. And if not, it hopefully will be soon after that. I think what happens is it's going to go away. This is going to go away. I feel about vaccines like I feel about tests. This is going to go away without a vaccine. I always say, even without it, it goes away. I think that at some point that's going to sort of just disappear, I hope.
You still believe so? Disappear?
Well, I do, yeah, sure, at some point. You know, I said it's going to disappear. I'll say it again.
But does
it's
that-
going to disappear.
that-
The virus will disappear. It will disappear. You know, I say it's going to disappear. They say, oh, that's terrible. You say, well, it's true. I mean, it's going to disappear.
Well, it's not true. It goes without saying. Never has been. And it's more than a little crazy that anyone, let alone the president, should need to be reminded. But he does, and today he was.
Is COVID-19 going to magically disappear, Dr. Fauci?
I do not believe it would disappear because it's such a highly transmissible virus. It is unlikely that it's going to disappear.
There you have it. Not going to disappear. That's science. And in a sad but somehow fitting capper on the week, the president just this evening made this remarkable statement with the gaslight turned up to 11.
Well, I hate it anywhere, but if you look at other countries are doing terribly. I will say this, proportionately, relatively, when you look at your nursing home situation, it's a tribute to your governor and government, the job they've done. I think we're doing really well in Florida.
Yeah, it's not true in Florida. It's not true nationally in this country. It's an expanding crisis. Deaths in Florida, for instance, hitting a new high today for the 4th day in a row. Joining us now is Dr. Eileen Marty. She's infectious disease specialist at Florida International